Hey everybody, this is Dan with Pain Free You. Today I have the pleasure of introducing Dr. Talia Steed from Perth, Australia. Uh, I'm going to just call you Talia. It'll feel more
Yeah, that's
comfortable. But Talia reached out to me. We've had some communication over the past year, or maybe a little bit more, just keeping in contact. Um, I'll let her introduce herself, but she just really wanted to have a discussion. Um, The core message is it's time for new thinking in medicine, and I'll let her kind of frame that belief. Um, and we joked around a little bit, and we're playing around with the title for this talk of It's Time for a Medical Revolution. And if anybody's been following me for a long period of time, I'm not anti-medicine, but it's a different angle on chronic ailments,
mm,
chronic symptoms and pains. Whereas mainstream medicine, as many of my audience knows, doesn't always know what to do with the chronic stuff. So, Talia, why don't you introduce yourself? Welcome. We had to,
thank you.
schedule this call. She's on the other side of the planet in Australia. It's early in the morning there, and it's late in the evening here. So, pleasure to be on with you.
Thanks so much, Dan. It's so good to chat. Yeah, so as Dan mentioned, I'm working in Perth, and my background was as a medical doctor. But as I was explaining to Dan, I'm now more focused on a holistic approach to health and healing and working as a holistic counselor and an author. And as Dan mentioned, we're not here to talk about or to bash anyone or say negative things about the medical profession per se. We're really here to, as Dan said, show how we need to broaden our thinking. And this isn't just medicine, this is society in general,
Right.
because medicine is just a reflection of society. So I guess this conversation is just about putting our ideas together and looking at areas of overlap to try and change thinking.
Hmm. That's great. Yeah, so I appreciate that. Um, there is a lot of growth in the medical world as far as their awareness and open-mindedness to this type of mind-body work. For
Mm,
example, I don't know if you're aware of the Mind Body Conference in Boulder in September. It was the old PPD Association. It's now called symptomatic.me. And a
mm,
lot of the medical doctors that have been leading the charge for getting this information out into the medical community, into the community at large, but a lot of information dissemination into the medical community. People like
mm,
Dr. Schubner, Dr. Clark. Dr. Clark is I believe, the president of this association. But a lot of the folks there, and I went last year, and there was about 250 some odd people, and about a third of them were physicians, which was really cool. Scientists, researchers, therapists, coaches, lay people, just regular people.
mm.
So there's I would call it a ground or a grassroots movement to spread this information around. So I think we're just going to have a casual conversation about some of the concepts and topics and see how maybe we can open some people's minds in the medical world, but also give some people in the, I guess, regular people who are dealing with some symptoms just a little bit more information from both sides of the fence. Somebody who's got a medical
Yeah.
training as well as me, who's kind of figured a lot of this stuff out through trial and error and life experience. So, where do you want to start? What would you
Well,
like
I
to?
guess I went through Dan's amazing book and there were some standout parts for me. And I thought what we could do is go through some of those standout parts and then have discussion around them.
Mhm.
So let's get started with I'll read a few quotes from your book, which I thought were really good. So this is on page 3. The medical field is full of professionals, practitioners, medications, devices, procedures, and more. Yet it seems that despite the vast number of medical resources available, the number of people suffering from chronic pain or illness continues to grow. Clearly, a mainstream approach is not working, and as a result, we are in crisis. And I think this is such a good point because, the number of people when I was working in general practice presenting with chronic health issues and being referred to pain teams, pain specialists, being on a lot of medication, it was
Mhm.
very disheartening. And often, it wasn't through lack of doctors caring about their patients. It was just, I guess, related to the fact that this isn't so much taught in the medical curriculum.
Right.
So yeah, that was a real standout line on page 3 of the book.
Right. Okay. I mean, my take is what I said there. I mean, there's so many resources behind chronic ailments, chronic illness, chronic pain, but yet they're not moving the needle forward in getting people better. And I believe a big portion of that is just that for the vast majority of people, chronic pain is not a medical problem.
Mm,
We have lots of diagnoses, lots of imaging, but as you know, most of chronic pain is created by the brain perceiving a problem.
mm,
And what we realize is for so many people, that perceived problem is a mistake by the brain.
mm,
And so a doctor's going to have a real tough time fixing that with surgery, injections, manipulations, massage, acupuncture, because it's not a body medical problem that can be fixed like a mechanic would fix a car. And
mm,
so this is not a negative to the medical. It's just this type of symptom behavior is different from what doctors are well equipped to deal with.
mm,
You
mm,
break a bone, go to the doctor. You get in a car accident, go to the doctor. Heart attack, stroke, cancers, go to the doctors.
mm,
There's a lot of really good things that the doctors are capable of. But as you pointed out, in the medical education world, chronic pain, chronic ailments are often not taught.
mm,
And that's actually because it's not a medical problem, so they don't have a solution that they can teach.
mm.
So we're kind of in that circle. They want to teach it, but they don't know what to teach. And so all
And
the
I think
doctors that I know are so well-meaning. So this is
yeah,
anything negative about the doctors.
no, and I think with what you were saying, it just like raises in my mind that, medicine is so focused on the body.
Mhm.
And, I'm really about a holistic approach, body, mind, and soul. And these chronic health issues that we face, they really link to mind, emotion, and soul. And I know you veer away from the spiritual side, and that's fine. I know you say you don't need that to get well, and that's true. But that is what it's really about when it comes to these chronic things showing up in the body. And
Mhm.
so I just feel like medicine, you know, eons ago was all about the real spiritual side. And then it kind of swung like a pendulum the other way. And it was really rationalism and linear thinking. And I feel, and I've written about, like it really needs to come to the middle ground so that we bring in body, mind, soul back together. And then doctors will be more trained to go, okay, well, if this isn't an acute problem, what is playing out on the level of mind and heart? Because as you write about, when we're afraid of our emotions or our thinking or other things in our lives, that's what's causing the perceived danger. So if
Sure.
doctors could be educated on, okay, well, we've ruled out the red flags. Here's my next set of questions. That could really help a lot of people.
Yeah. And Dr. Sarno was great at that because once he realized, okay, there's no life-threatening crisis,
Mm,
he would start asking people, what's going on in your life? Tell me what's happening.
mm, mm,
And he would very quickly steer the conversation away from, you know, did it hurt when you bent over? Which is a very
mm.
mechanical, leading question. So, yeah, I think Dr. Sarno did that well. And there's a lot of current practitioners, medical doctors, some of the names I've mentioned who are very focused on, let's look at the other side of this. What's going on in your life?
And
So,
it's interesting because obviously you're in America and I'm in Australia and Perth. And
mhm,
Perth is quite an isolated city. It's a lot of the eastern states might be a little bit more progressive, but I found working, in the medical community here, it was challenging. And that's part of the reason why I
Right.
broke away because that way of thinking, like you're describing, there's not a lot of people who think like that here. And when I was on my own perceived danger symptom journey, trying to navigate help, knowing in my being that it was my nervous system and fear and stress, and being guided to stool testing or microbiome or all this stuff, take all
Yeah.
these products, the amount of money I spent on all these products that made me feel sick.
Yeah.
Like, so that's still where, even if you see a naturopath here or uh, go to the Chinese medicine doctor, like there's still a focus on the physical in
Yeah.
Perth. So it was harder. Even when I went to holistic doctors or integrative doctors, no one really wanted to, once it wasn't, I guess, medical or even like deeper medical through testing,
Hmm.
they didn't ask the questions. And I was at a point pre-Dan that I hadn't found you yet.
Right.
So yeah, it's interesting, I guess, reflecting on different places in the world.
Yeah, it's not even just that they wouldn't want to ask the questions, it's just that they
Mm,
haven't been shown the value of doing that
mm,
through their formal education or through their clinical experience. So
mm,
it doesn't even cross their mind for
mm.
a lot of people.
Well, that's right. That's right.
And
Yeah.
that's no fault of their own.
Yeah. So I guess that brings me to another quote that I thought was a standout here. Um, so when you say they are well-meaning, smart, and caring, but they're just not taught about these mind-body concepts.
Mhm.
They're simply not aware and don't know what they don't know. And that's so true. I mean, that's such a common principle in psychology. We don't know what we don't know. And it sums up a lot of, I guess, the thinking still here. I had beautiful colleagues who are really well-meaning and thinking they're doing their best, getting burnt out because they're trying so hard. And yeah, it would just be so wonderful if we could get into the medical schools more of this education around chronic pain, chronic symptoms. What do you
Yeah.
think?
Well, I mean, I know a lot of medical doctors, many of the people I went to like high school with, and that I see at the high school reunions. Many of them are doctors. They're very well-meaning. And my son's got a best friend who's now an orthopedic surgeon. Everybody is super smart, well-meaning, cares
Mm,
about their patients. And it's not an insult to say that they don't know what they don't know because they're
mm,
not exposed to it.
mm,
And unfortunately, it's people like myself and other doctors and therapists and people writing these books, and they don't really catch the mainstream attention that often. I know
mm,
Nicole Sachs just put out a new book and she had some media appearances, got a pretty big audience from that, but
mm.
it's just not showing up in the medical journals and
Yeah,
continuing education curriculum for the doctors. So, what I find happening is many of the people who watch my videos or in my group coaching program end up taking my book to their doctor and saying, "Are you
yeah,
aware of these concepts?" One lady's actually given out 10 of my books to friends and their doctors. So it will spread, but it's a little bit more, a
yeah,
grassroots from the ground up movement as opposed to let's get it in the curriculum. Because I don't
yeah.
know that they're going to want to teach this because it's hard to monetize saying you're actually okay, go home, you don't need treatments.
Mm,
And that's
mm.
not an offense to the medical world either. It's just the reality.
Yeah, yeah. It's interesting you say that about your coaching clients taking the book to their doctors because my friend is a pediatrician and I actually took your book to her because in medicine, there's this functional disorders title, which is
Mhm.
everything that they don't know what to do with. And
Right.
and it's basically, irritable bowel, fibromyalgia, anything chronic is called these functional disorders. It's related to mine, but then it's like, okay, and that's kind of where it stops. It's like, now what? And so she works with children who are going through a lot of, gut issues and a whole host of pain and neurological symptoms. And I said, you need to read this book by Dan Buglio. And that's what she's trying to bring in because she's a beautiful, kind-hearted doctor. But you can imagine even that's tricky, right? Because
Sure.
you are not just working with the children, you've got the
Parent.
parents. And she says part of the biggest struggle is actually trying to convince the parents as well that, there's nothing physically wrong with their child. And that's a huge thing as well.
It's like the parents are saying, my child is sick.
Mm,
Fix my child.
mm,
Treat my child. Let's get my child better. And to implicate emotions, stress, life, potentially trauma.
mm,
And in some cases, the parents are implicated in traumatizing the children, which
mm,
lead to these things. This is not blaming or shaming parents at all.
mm.
Um, Sometimes that stuff happens in school or neighbors or whatever. This isn't about blaming anybody, but it's mostly about
Exactly.
we do need the parents' buy into this. And I have seen some cases where people take this information in the book or in the videos and they can really help convey safety to the children without explaining the concepts because these kids
Mm,
might be 4 years old and they don't need to understand the concept of perceived danger creating symptoms and safety is a solution, all the things I've been talking about. The children don't have to know that. They just have to know that mommy's got you. You're going to be
yeah,
okay. Yeah, I know your tummy ache hurts. Yeah, sometimes, emotions or stress or fear about school can cause that, but you're going to be okay.
mm,
That's very healing to a child.
mm,
They don't need to understand like the intricate technical details of it. So
mm,
you're right, though. Getting the parents on board is a big deal. I actually know and have become acquaintances with a dentist, and he oftentimes is conveying this information to his patients. And in the
mm,
case where the patients are younger, he's conveying it to the parents. So the word's getting out there for sure. So
mm.
that's really encouraging to see.
Yeah. And children, I just recalled working with a client once, like they actually more receptive because they know it. So like this boy actually did have stomach issues and I said, well, when do they tend to show up? And he said, oh, when I go to my room. And I said, well, what happens when you go to your room? And he goes, I think about things. And I said, well, what do you think about? And he said something like, oh, he's disappointing his parents about something. And I said, which comes first? The pain in your tummy or the thoughts? And he goes, the thoughts. And I said, well, do you think that that could be impacting your tummy? He said, yes. So you see, children,
Sure.
they know they haven't, all they need is a little bit of guidance.
Yeah,
And then we can empower, everyone coming through to just understand the body mind connection a little bit better. I think that would be amazing. Even in schools, they could, bring this into the curriculum.
absolutely.
Mm.
All right. I know you said you made some more notes, so I'm going to let you lead the,
Yes, sure.
working
Yes, no.
through the topics that you
I've got
wanted
my
to discuss.
post-its on Dan's book.
No, that's
Um,
fine. And it doesn't have to be 100% book. It could be whatever else you want to talk about.
Yeah, no, I think what was also really important, whilst we're still talking about the medical profession, is you wrote about the nocebo effect. And I think that is something we need to talk about. Well, I'll read what you wrote. So, doctors often make statements that our brains interpret as nocebos. And a nocebo is the opposite of a placebo, meaning that it creates the belief that we are broken or that something is bad for us. And I think we also, what I really advocate with the people I work with is not putting anyone's opinion above your own. So, always being open-minded and listening to what everyone has to say, but then filtering that through discernment and what feels right for you. Because, you could meet 10 different doctors and they would come up with 10 different management plans. And if we outpour our power to some other external source without filtering, does this actually sit well for me? We end up being subject to this nocebo effect where someone says, and this is very, very prominent with chronic symptoms, doctors or other health professionals will kind of say, treatment resistant, phrases like this. So when I worked in psychiatry, it was very, very disheartening when phrases like treatment resistant, chronic paranoid schizophrenia were thrown around. Because once someone gets that label, what hope do they have in if they take in from the doctors that they treatment resistant? And it's the same thing with IBS. I know many people, irritable bowel syndrome, they kind of told, oh, this is a very difficult, you know, diagnosis. There's nothing that can help you. So what do they believe? Oh, there's nothing that can
This
help
is
me.
my life. Yeah.
Yes, and that sets it in stone, and our beliefs are so powerful. So I think that that is important, not just about doctors, about anyone outside of ourselves, especially when we're on a perceived um, danger, symptom, or pain journey. We are looking outside of ourselves because we're desperate, and we have to
Wow.
be very discerning what we take in. I think
Yeah.
that's really important.
Yeah. The nocebo is basically you're broken. This is bad for you. Don't do this. Like for me, I had back pain for a long time. Don't bend over. Bend at your
Mm,
knees. Don't lift too heavy. All these things are nocebos, which put fear and limitations into your life.
mm,
Placebo is this is good for you. Take this pill, your headache's going to go away. It's a sugar
mm,
pill. It's not, a pharmaceutical drug. So I think the term placebo is very well known. The nocebo term is less well known, but I think a lot of the people in this community have firsthand experience with that.
mm,
One of the things that I teach often is just because somebody says it's not curable doesn't mean it's not curable. It just means
mm,
they don't have the cure. So they're
mm,
saying it's not curable. And unfortunately, there are many conditions out there that you go to Google, what is this? And they will say, we don't know what causes it and it's not curable.
mm,
Wow. And you were
mm,
just given that diagnosis from a doctor. And so everybody goes, holy cow, this is the rest of my life. I'm going to be
mm,
like this forever. And it gets very interesting when you try to expose that community of people diagnosed. I'll use fibromyalgia as the example. There is a community of people diagnosed with fibromyalgia that if you try to introduce to them the concepts which we're speaking of here, the mind body work, they get very defensive of their illness. What are you talking about? I'm really sick and it's not curable. Don't you dare tell me I can get better. What are you trying to take advantage of me and sell me stuff? And
mm.
I'm sure you've seen it out on the internet. It can become very combative, and it's such a shame because there are entire communities in the chronic ailment world that believe there's no hope. And how dare you try to tell me there is? Don't sell me false hope because there is none, which is so disheartening.
It's very, and I think like that feeds into, what you talk about a lot in mindset and this belief in, a journey with anything showing up physically or on the mental, emotional level is all about like it's come into our life, I believe, for a reason. And often, there's been a lot of anxiety or fear in us, and we're kind of being called to shift how we feel about ourselves and become a person who takes self-responsibility to shift our inner landscape and believe that we can cope. So I often notice this almost defensiveness of a title or attachment to that incurable kind of diagnosis when someone may not be ready to do what they actually need to do to go beyond it, because we can only change if we're ready to change. And as we all know, if we've gone through these symptoms, that's not something anyone can do for us. It's, as you say, it's every moment and every day. And you talk about meditation and things like that. I love meditation. I love yoga. I'm a yoga teacher. But even I say to people, like, I can get into a deep meditative state for a long time and then come out 5 minutes later, the same, thinking and fear about the symptoms that can show up. So, unless you implement, like you say, in every moment, you've got to put in the work. So, a lot of that defensiveness is when perhaps someone's not ready to take that full self-responsibility, and that's okay. We can show compassion, but ultimately that's what it will take, you know?
Yeah, nobody can do this for you.
No.
Um, and I walk people through the foundational stuff. Like we have to understand what's causing the symptoms because in many places people are given a diagnosis without an explanation as to what the cause is. And in
Mm,
many cases, it's because the people offering the diagnosis say right on the internet, we don't know what causes this. It could
mm,
be genetics, environment, diet, lifestyle, this, that, and the other thing. It could be autoimmune, could be all sorts of things. And so, learning how this human system works is one of the things that I try to teach. And I don't have a medical background. I've got 60 years in the school of life, and I've had 25 years of either having chronic pain or studying it and now teaching it and coaching it. And so I just try to simplify like symptoms are warning signals,
mm,
not evidence of damage or illness. It's a warning. Sometimes it is damage or illness,
mm,
legit, right? But not always. And in the
mm,
case where it's not evidence of damage or illness, there's a solution. We can teach the brain that this is a false alarm. So the
mm,
key is learn how the system works, figure out if your symptoms are behaving like this mind body type of condition. And then if that's the case, then wow, I can teach my brain to turn off these symptoms. And that's really the crux of everything I try to do on a daily basis is what's going on? Does it apply to you? And if yes, let's work on how to teach the brain. Uh,
mm.
so I don't know if that's helpful to, where we were going on that last point, but I don't know. So what else you
Well,
want
I
to talk?
guess that where that kind of triggers my brain to go is like the next area that really resonated with me about emotions and thought, because I thought your take on expanding, your principles from the physical symptoms that can show up to thought and emotions can really be triggers for our perceived danger symptoms, whether the perceived danger symptoms are in the body or the mind. I think those are really important concepts for many reasons. Maybe we'll start with emotions. Um, but we're really not taught to how to manage our emotions. It's
We're taught
something,
not to.
pardon?
We're taught not to deal with our emotions.
Yeah,
Oh,
basically.
you're
Yeah.
crying? Let me give you something to cry about. What are you mad about? I'll give you something to be angry about. Like, go put those emotions away. They're not acceptable. And
Yeah,
they're
or
maybe
you're
a
too
little bit.
sensitive. Like, you can get that you're too sensitive, you're too emotional, and so you internalize that there's something wrong with me, right? So then as you evolve into your adult life, you've got this fear of your emotions. And, I think many times I would send you a message on Facebook when I was really in an emotional state, and until we can, part of this journey is learning how to manage and regulate all that fear so that
Mhm.
it doesn't have to, as you've you know taught in your book and in your daily videos, so it doesn't have to hurt. You always say life is, I guess I remember that life is lifey, but we don't have to hurt.
Yeah.
So the
Stress
journey
is not the
about,
problem.
yeah, learning to not fear the emotions,
Mhm.
because I think for myself, like then it became, as I went along that journey, if I became emotional, it's like, oh no, I don't want to be emotional. I don't want to get symptoms.
Right.
And so then we become afraid of the emotions instead of going, okay, emotions are okay, all of them,
Mhm.
and I don't have to fear them. It's not the emotions that are causing the stomach pain, it's the fear of the emotions. It's fear.
Yeah. And we are taught that at such a very early age that
Mm,
emotions are not good. How many times has somebody said to somebody else, don't ever let them see you cry. Be
mm,
strong. Don't be weak. Don't be a baby. You know, Anger. Does that mean you're out of control and dangerous if you're angry? There are
mm,
so many misperceptions about what emotions mean about me. In my case, I didn't want to be angry because I didn't want to be like my dad, who was kind of an angry guy. And so we have all these perceptions about emotions. So Dr. Sarna was right. The brain was creating symptoms to distract, and I like the word protect,
Mm,
distract us from the emotions. He said primarily anger and rage repressed. But there's so many other things that the brain could perceive as dangerous,
mm,
right? And so um, I believe Sarno's right. The brain can perceive emotions as dangerous based on the things we just spoke about, but we don't have to go dig them up. We can,
mm,
if the brain is perceiving emotions as dangerous, then how do we teach the brain that emotions are safe? By feeling them without judging
mm,
ourselves.
mm,
It's like exposure therapy to our own emotions so that the brain
mm,
goes, wow, look at Talia. She's feeling all these intense emotions and nothing bad happened. I guess emotions are safe. And now all of a sudden the dial is turned off on the brain creating symptoms when you have emotions.
mm,
And so I just simplify it. What's the root cause? The brain fearing the emotions. Let's teach the brain they're safe.
mm,
Greatest path to that, feel your emotions.
mm,
Not years of therapy and digging and trauma work. And look, there are cases where people need that. I'm not diminishing psychology, psychotherapy, trauma work. Those things are valid. But in the world of chronic pains being turned on by emotions, I think if we can learn to experience our emotions without judging it, without getting looped into the rumination that so often happens, the brain will learn that emotions are safe.
mm.
Again, there may still be a lot of value for individuals to deal with some trauma therapy and trauma processing. Um, but I don't know that that's necessarily a requirement here. It may be, but I don't want to make it a mandate and send
Mm.
people off to do all of this deep, 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 deep emotional diving work if a lot of people can get better without that.
Yeah. And I think people will know if they've got a deep trauma and they need to go and do some trauma work, or if their issue has become, because I know in my own journey, there's a time for, therapy and psychological work around whatever you're going through. And there's a time where you feel like, well, that's past. I feel like I've healed that. And why do I still have symptoms? And that's when, it's really important all your stuff comes in. Well, this isn't about that trauma anymore. This is about my relationship with the symptoms. So
Yeah,
that's when you've really got to start to look at how you are sitting with your emotions and your thinking and all these things and realize, often a trauma can start off the process, but then it's resolved. And now it's time to deal with your relationship with the symptoms. And
yeah,
that's a whole different thing. That's the symptom fear cycle.
yeah,
So,
absolutely. How do we respond to our own symptoms? Will either perpetuate the brain's belief that there's a
yeah,
problem, danger, or will convey, no, we're actually okay because we understand where the symptoms are coming from, that this applies to me, and that I'm actually okay. So then I can respond to symptoms without all of the terror and panic, which typically perpetuates the symptoms. But
mm,
so, yeah, I do believe emotions play a part, and that's one of the safety strategies I talk about. Mental, emotional, physical safety, safety with self.
mm,
You touched on the spiritual side of it, and as I was writing this, I didn't really know how to tackle the spiritual side.
mm,
I got better without a deep spiritual belief or
mm,
practice, and so I didn't want to include something that I didn't have direct experience with, but I
mm,
do equate the sense of self with spirit.
mm.
And if we treat ourselves well, that's a that's a solid spiritual practice in my mind.
Yeah.
If we're constantly criticizing and judging and blaming ourselves for things, that doesn't sit well from a spiritual perspective. So I don't go deep into any of that because I didn't really have that deep experience, certainly not when I was writing the book, and I didn't have that belief system when I got better.
Yeah.
So I just stick with the things that worked for me and that I'm seeing work for so many of the people in my audience. So I
And you
do,
see, and I think that's a really important thing for us to convey. And then so your work has then been able to help so many people through and you've put it out there. Well, you didn't have that spiritual foundation and you don't need that to get better from perceived danger symptoms. And that's great. Whereas in my journey, I've had a strong spiritual foundation prior to receiving guidance towards your work. But I look at it a bit differently. I look at it like, well, I did need the spiritual foundation to guide me because then that spiritual to me, I guess, is about alignment to self. Because the more aligned to myself I became, then I found the right practitioner. And it turned out it was actually a naturopath in the end, who, but in Sydney, who then said, "Have you heard of Dan Buglio?" And I said, "No." And that was the beginning of my true healing from perceived danger symptoms, right? But for me, and this is why my work is a little different to yours, I needed like the spiritual framework. There were so many other parts of my journey that did help me move through. This part of my journey around the symptoms and things showing up in my body and mind, then it was a different part of my journey. So the spiritual for me was all encompassing, and then that led me to your work, which was more focused on these specific parts of my life. And I think this is why we need to be so true to ourselves, because for you, you didn't need the spiritual. For me on my journey, I did. And there'll be people, you know, everyone will have a different story, and that's okay. I think that's really important.
And I do believe, like you even just reiterated, you said it a little bit differently, that alignment with self was your spiritual path.
Mm,
And, 5 minutes ago, I said, well, I do believe that the way we treat ourselves
mm,
is spiritual,
mm,
right? Because if you're yelling at yourself, beating yourself up, that sucks the soul out of our spirit. And we're doing
mm.
it to ourselves in many cases.
Yes.
So if we can learn to be more self-compassionate and caring and, look for opportunities to do self-care, which is a proactive thing that you need to say, this is a priority. I'm going to get out in
Mm,
the sun. I'm going to take a walk. I'm going to sit and pet my dog. I'm going to do things that make me feel good. That's all
mm,
self-care. And there's a lot of spirituality to that. Um,
mm,
but I didn't really want to come across as preachy that,
mm.
you need God to get better. And because there's many people who are like, well, I don't know.
Yeah.
I don't
And
know
it doesn't
about
have to be, I mean, for me, spirituality is nothing linked to religion or anything like that. And it can be different for different people. I think the bottom line is, you know, that there's no one right path and that we all have a different overall journey.
that.
But for this particular part of it, your approach is everything because it's it's really, focused on the perceived danger symptoms and this is what helps. And you don't need the spiritual, but if there's been other things that bring you, like myself, to this moment in time when I think we get the point.
I
So,
want to point out, like everything I do is let's take it up to the highest level of problem solution, right?
mm,
Because we can get tangled up in the weeds of spiritual thinking, meditation, breath work, all these things. These are all tools, techniques, concepts. But at the core, if the brain is perceiving danger, symptoms are the result.
mm,
And so if perceived danger is the problem, then safety, that's a very broad term, but essentially teaching the brain we're not in trouble is the
mm,
solution. So I love the fact that I can be in a group coaching call with X number of people. They all have different symptoms, but they all have one root cause, danger, and one
mm,
core solution, safety. And the
mm.
concepts that Susie can use to convey safety to herself are the same as Tom.
Which
Because
I think,
it's a
you know,
human condition. Sorry, go ahead.
exactly, which I think from the spiritual perspective, like, not that I'm like trying to push this at all, but I'm just trying to give a broader perspective or expand the conversation. Like, that just shows that fear is part of the collective consciousness of human beings. And so we all having our own journey in shedding fear, which, is linked to ego, mind, and the collective, and step into our higher most selves, which is alignment or being kind to yourself or however you want to view that. So we can kind of look at the same thing from just slightly different angles, but it is about all doing our part to shift from fear into more love in the world. And that's going to have a profound ripple effect on our world. So we all having different journeys, they look different, but
Yeah.
in the end they're similar. And I think that's part of it as well.
Awesome.
Yeah.
What else do you want to cover?
Well, there's quite a bit more. Do you think we should do part two, or do you want to keep going?
I don't have a deadline. If you would like to keep it going, that's fine. We could always just cut it and split it up into two. But
Yeah, maybe
it's up
we
to
should
you.
do that.
If you would
I
like to
think we should,
keep going, let's keep going.
yeah, I think what we should do is put it out to anyone watching from what we've said so far, what do they want to hear more about, or what do they think would be interesting topics for us to continue. I've got a few more if we don't get anything back, but I think a part two would be lovely if you're open to that.
Absolutely. So let me invite the audience, the people watching. If you enjoyed this conversation and you'd like to hear us dig a little bit deeper on any of the things we talked about or expand more on other topics, comment below. We'll be reading all the comments and taking your feedback. And, Talia and I will schedule another call. It's a little bit tricky because we're 12 hours apart, opposite sides of the globe. But yeah, if you want to wrap it up here, we can absolutely do that. And then we'll do a part two.
That sounds great. Thank you so much, Dan.
All right. Well, listen, I really appreciate you.
You
Appreciate you
too.
reaching out and all your kind words about my work. So, real pleasure to have a friend and associate across the globe. Very cool.
Yes, it's
If you
amazing.
ever come to the US, look me up.
I will. Thank you, Dan.
All right. Thank you.